February is Heart Month, and during that time, we're going to be talking to people from Rochester Regional Health about heart health. This week, our guest is Dr. Vishal Parikh. He's a heart failure cardiologist, which is what we're talking about today. Good morning, and thanks for being here.
Good morning. Thanks for having me.
Heart failure. Let's just get right to it. What is that?
So heart failure is basically when the heart just can't keep up with the rest of the body. It's either because the heart is weak and not squeezing well, or the heart's really stiff and doesn't relax well. And it can cause a lot of symptoms such as shortness of breath, water retention in their legs and stomach, fatigue, tiredness, loss of appetite, and mental changes as well.
Sure. You listed some of the symptoms. Is it something that is onset abruptly, or are there signs, telltale signs along the way that could give someone the indication that your heart is not in good shape?
Sure, I think it can happen either way. So initially, somebody might have these symptoms of shortness of breath, but it usually gradually gets worse and worse. And oftentimes it gets to a point where they just can't handle it anymore and they come to a physician.
Yeah, by that point, is it something that can be fixed, or is this something that you live with?
Sure. So I think the first step is to investigate the underlying cause of why the person's heart function is weak. You check is the plumbing, the arteries clogged up? Is that an issue? Is blood pressure uncontrolled? Is some issues with the valves? Is the electrical system not working well? So you figure out the underlying cause, and then you put all these people on a guideline set of medications that work all in different ways to help the heart recover. And the goal is for heart recovery.
Is that something, the medications that are prescribed, are they something that a person's on for the rest of their life, or is there a point where they don't have to take those medications anymore?
No, I think typically they're on for the rest of their lives. Okay. The data shows that once they get off these medications, there's a high recurrence rate, so you keep them on.
Who's most at risk of heart failure? Are you seeing this across the board in many different age groups?
I think majority of the time, if patients have uncontrolled high blood pressure, diabetes, obesity, those are patients are more likely at high risk. But we can see young patients who are marathon runners get it. So it's hard to tell, but obviously it's better to control the risk factors that you can control.
You also mentioned some other factors that seem to go alongside that: diabetes, high blood pressure, cholesterol, I believe you mentioned.
Yes.
Those are things that can be treated or can be managed before it gets to a point of heart failure, right?
Absolutely.
So what are some ways that people can take care of their bodies?
Diet and exercise are the biggest things that everyone needs to keep an eye on. Stress management is also very important as well.
Yeah, stress. Yeah. How do you handle that? There's so much of that in this day and age, right? Yeah. What do you usually tell, patients when it seems like you're kind of dealing with the worst case scenario many times.
Yes.
How do you help someone kind of get things back on track to maybe reverse course a little bit?
Absolutely. So, you're not treating just the patient, you're treating their family. And it takes a village to really be able to take care of these patients. So you just give them the education. You tell them how serious the disease is. It can be as bad as some of the worst lung and pancreatic cancers. Wow. So you tell them how important it is to take care of your health. And at the end of the day, you provide the roadmap and the tools and education for the patient to succeed and overcome the disease.
Yeah, and during Heart Health Month, we want people to be aware of what's out there. So maybe taking some corrective measures now to be good to your heart now.
Absolutely.
Before it's too late. Where can people go for more information if they have concerns about themselves or maybe a loved one?
There's plenty of stuff on the internet. There's good and bad, but the key is just to make sure you stay active, eat well, watch your salt intake, eat kind of a plant-based diet, and do the best you can.
Dr. Parikh, thank you.